Good afternoon, everybody. So this is session 3 for today. We've had really an exciting, informative day of speakers for the first 2. And on behalf of the committee, my co-chair Charmaine Rao, and myself, I really welcome all of you to this session. We're really looking forward to hearing from you and the many other individuals that are introduced to you, Dr. Katrina Claw. Katrina is going to moderate this session, and Katrina, please take it away. Thank you.
Thank you. Thank you all to the speakers who are joining us now for the final session of today's workshop. The speakers for this session were chosen in part from a public comment opportunity that our committee has opened so that we may hear from any member of the public who wishes to contribute to our work. On our study website, you can find a link to the public comment portal. To briefly summarize, we are asking folks to provide their thoughts on how they personally identify and how population descriptors should or should not be incorporated into genomic research studies. The public comment period will remain open through June 1st, and we will be selecting another round of comments to be presented at our next committee meeting on June 14th. We are hoping to hear from a wide variety of stakeholders, including researchers, clinicians, patients and advocates, research funders, publishers, industry, and government representatives. During this session, we will hear 5-minute comments from a variety of stakeholders. And if there's any time remaining at the end, we will ask the committee here to ask the commenters any clarifying questions they may have. Unfortunately, we will not be taking questions from the public during this session, but I'd like to encourage all of you who are watching the webinar to please submit a comment to the portal. Since we have quite a few speakers in this session, 8 speakers total, I'll try to keep speakers on time and give a 1-minute warning to wrap up. So with that, I'd like to introduce our first speaker, Dr. Catherine Pociński, Chief Editor of Nature Genetics.
Great. Thank you so much, Dr. Claw, and thank you to this National Academies Committee for all your work. We, as publishers, think that this is really important, and so we're grateful for the opportunity to be able to share our thoughts with you today. I do note that I'm actually at another conference. It's the first in-person conference that I have been to in 2 years, and so I unfortunately have to leave the session after I speak. But we're very interested in remaining involved and kept up to date on what this committee finds and the discussions that they have. So thank you for including us. So to start off from a journal perspective, the challenges that journals face with population descriptors in genetics research are largely those of imprecision and inconsistencies across geographies and subfields or even disciplines. As now genomic research is part of so many different disciplines, their practitioners may be less careful with these descriptors than genomicists themselves. And I'll go through some of the questions that we were prompted with. So how are we seeing population descriptors such as race, ethnicity, and ancestry being used or not used effectively? So right now, I think from the journal side, we see race, ethnicity, and ancestry are not always used consistently, and they can be conflated. Ancestry, we think, can usually be used effectively, as we ask that this be reserved for descriptors or descriptions that are grounded in DNA analysis, and this can be applied universally across countries and across studies. Less effective then are the terms race and ethnicity, for which we see much more heterogeneity in how these are used and what they are describing. And these can have different meanings and different usage in different areas. Most importantly for these terms, what we can and do ensure is that race is not being conflated with ancestry or that it's representing a biological entity. So we do think that the distinction between what we're talking about biology and what we're talking about sociologically isn't always clear and could be clearer. So in terms of what population descriptors, if any, should not be used in genomics research, Springer Nature has a no harms policy and a sensitivity guideline around language that we follow. And this is based on other such guidelines that the American Psychology Society has, et cetera. So we follow that to ensure that offensive and outdated terms are not used. So we have things in place right now, but we do agree that that antiquated and offensive terms should not be used. Do all genetic studies need specific population or individual descriptors of study subjects? We actually do think it's important that genetic studies have specific population descriptors. We think that this helps with accuracy, it helps with data, and so we do think that this is something that the field needs. And then I'll just make a couple comments on what aspects of the current population descriptors in genomics need to be changed or improved. So in articles, we can ask for a very high level of detail about ancestry or cohort composition in methods, supplementary reporting summaries. So that can all be exhaustively, explained, and authors can be transparent in their descriptions of the genetic cohorts and how these were collected. However, in the articles and text figures themselves, the space is more constrained. So having informative abbreviations or shorthand descriptors that are easy to convey yet still capture the complexities would be very welcome. Descriptors for admixed populations could be improved, we think. And of course, as has been mentioned, legacy data descriptors can be a problem. And then moving forward, how should population descriptors be used in genomics research? We wanted to make the point that in addition to publishing primary genomics research, we also publish review articles, commentaries, news articles for a broad and very oftentimes non-genetic audience. So thus the terms used in the research articles ideally could also be accessible, so clear, easy to understand, when used in material that's aimed at non-genomicists or even non-scientists. And with that, I'll just say that we're very glad that this conversation is happening. We would like to do whatever we can to help support. So we would just, we'll keep following up with this committee and listening and seeing what we can do to help. So thank you very much.
Thank you, Catherine. Our second speaker is Ms. Donna Cryer. She is the president and CEO of the Global Liver Institute.
Good afternoon, and thank you to the National Academies. Yes, my name is Donna Cryer. I'm CEO of the Global Liver Institute, which is a nonpartisan, nonprofit patient advocacy and service organization with offices and an affiliated network of community organizations in the US, Canada, UK, and EU. I'm also a past member of the board of the Personalized Medicine Coalition. However, these brief remarks are my own. If I were to give this patient public perspective a title, it would be Family History is the Stuff of Legends, Why Self-Reported Ancestry and Identity Are Insufficient to Guide Genomic Research. And I say that because when we really look at what is the purpose of genomics-based research, it's to understand the opportunities and differences in response to drugs, devices, and other interventions in clinically meaningful ways and amounts. And we need to keep that in mind. What's the purpose of this research? So that we find solutions that fit that purpose, that allows us to engage and include a sufficiently sized sample of people to assess the benefits and risks. And the solution needs to apply not only to the United States and our unique history around race, ethnicity, and ancestry, but globally. And it's important that we get it right in both contexts so that we can make sure that simply moving research outside of the US for simplicity's sake does not result in US patients being asked to take medications, for example, that have no relationship to our particular genetic makeup, and vice versa. I put forward that self-identified ancestry and identity cannot be proxy, at least not fully. And I'll point to two examples. One is the fluidity of who claims African descent. We see it increasing in Hispanic populations as the stigma against dark color and curly hair recedes. The underlying genomics of the population did not change, but the self-identification did. I also would have you look perhaps a little tongue-in-cheek at what I refer to as the case of my mother versus 23andMe. She would have me qualified to enroll in Native American studies if she were to be believed, but my genetic analysis testifies otherwise. This is not an argument in favor of abandoning population descriptors based on race, ethnicity, or ancestry. We need them because only what gets measured mattered. If we abandon them, we will not know and understand how different populations benefit or the opportunities of interventions that may not resound generally, but only in specific populations. So I would propose that genetic testing at scale, direct-to-consumer genetic testing for a larger number of people at lower costs, so people can understand the truth that they can then contribute into trials, and the use of a combination of factors to recognize that almost all of us are at some intersection or admixture. So when we think about what's really called for and why we cannot abandon this very important project, it's because we not only need the contribution of genetic data and information from people to research, but from research back to people who can use it. So thank you very much.
Thank you so much, Donna. Our next speaker is Dr. Agustin Fuentes. Dr. Fuentes is a professor in the Department of Anthropology at Princeton University.
Thank you so much, Dr. Klaw, and thank you to the committee for this invitation. And thanks for everyone who's presented today. This is very important and very powerful. I'm speaking to you as an anthropologist, but an anthropologist who works on human evolution, human biology, and how that is used in the academy and in the public. I navigate both landscapes. I'm going to repeat what's been said a lot today, but I want to keep it very focused on the charge to the committee. Race is a socio-political construct rather than a biological one. And while the scientific community, by and large, has this knowledge, it is often ignored, and race remains commonly used as a surrogate marker for genetic ancestry and diversity in genomic studies and in biomedicine. This practice is based on the erroneous assumption that a socially defined category, race, serves sufficiently as proxy for genetic ancestry and as concomitant representation of genetic diversity, and it does not. To be clear, there's no genetic homogeneity or biological unity in race categories, Asian, Black, white. However, some markers of ancestry can contribute understanding to patterns associated with populational demographic histories, such as various aspects of human health. The concrete and contextual usefulness of actual genetic ancestry data and markers, ancestral recombination graphs, and patterns in the assessment of human genomic variation processes across time and space is actually the key point for discarding race as a category when assessing genetic targets in genomics research and in medicine. As many speakers have said here, race is important when the questions are about racism. Indeed, the use of race instead of actual genetic ancestry and our specific reference to the sources of samples analyzed in genomic and clinical studies can result in a variety of consequences, such as mischaracterization of genomic and evolutionary patterns, misrepresentation of human history and biology, misdiagnosis of clinically relevant syndromes, and even adverse drug reactions. So we must not also then replace race, as is frequently happening, with the artifice of continental labels or the often vague and always non-biological category of ethnicity. Continental units are false proxy for human genomic structuring. Contemporary usage of continental ancestral categories, European, South Asian, East Asian, American, African, what have you, presumes that these geographical categories are equivalent to biological groupings. There is substantial and widely available data from evolutionary sciences, from biology, from historical sciences, from the social sciences, and from the genomics itself that refute this assumption. And the continued use of continental groups in genomic research acts to obscure the actual diversity and structuring of human genetics, past and present. The use of continental groupings to describe humans emerges from and corresponds to Western racialized categorizations, and it assumes a genetic homogeneity based on geographical separation that does not and has not ever existed. Continental labeling misrepresents the actual distribution of genetic variation and neglects the movement of peoples across time and space and underplays the degree of dynamic relations among populations across the globe. How we define those populations, well, that's what you've been fighting with here. And while I won't go into detail in this few seconds I have, the social linguistic historical category of ethnicity, such as, for example, Hispanic Latino in the USA, is an even shoddier proxy for genetic groupings, and using it just as a genetic representation is incorrect. We can and must do better. We must aspire to research, scholarship, and assessments and treatments based on actual and not assumed genetic variation, and the social, historical, structural context in which the bodies and lives of the people that we're interested exist. That means assessing the patterns of diversity that reflect the distribution of human genetic variation across the globe, not proxies thereof. To achieve this, genetic ancestry must be understood as a continuum that is not categorized in such a way that serves as a surrogate for race or continent or ethnicity. How might we do this? To start, genomic research should not begin or end with reference to race or continental origin or ethnicity. Accurate descriptions of the actual reference populations, biobanks, or other sources of genetic variation data should be the terms used both in the research and the publication. Here I echo what was just said a couple speakers before me. If you're using UK biobank data, then define specifically how that pool is constituted and use that description instead of the shorthand European. If you're using data from 23andMe or other commercial ancestry companies, do not use their gross geographic or ethnic categories, but rather name the specific reference populations and the clusters of data that they're comparing to them. If
we have a little under 1 minute.
If using genomic data drawn from non-biological groupings such as Hispanic, Black, or White in the USA, be explicit about that and understand and respect the limitations of such sources' places on the ability to extrapolate to population-level biological patterns and processes. We as scientists know how to do non-racist genetics. I urge the National Academies to think fully, integratively across the biological, social sciences, and the humanities, and to mandate that such practices in an anti-racist context be the norm. Thank you.
Thank you so much for that perspective, Augustine. Our next speaker is Dr. Charles Rutini. He is the president of the American Society of Human Genetics and also an NIH investigator.
Thank you very much. I have a couple of slides that I would just like to use to make my points. And I'm going to share that. So let's see here. Do you see my slides? Do you see my slides, please?
Yes.
Yes.
Oh, fantastic. Great. So again, I just want to start by saying that my comments today reflects my capacity as the 2022 president of the American Society of Human Genetics. So I'm really glad to represent our society here today. Just a short description of our society. Is the world's largest organization for human geneticists. It has about 8,000 members, spanning researchers, medical geneticists, genetic counselors, and a whole lot of other disciplines. Majority are in the United States, although we have members in a lot of parts of the globe. The vision of ASHG really is to make sure that human genetics and genomic research benefits people everywhere. That is really our marching order, and is what our society live by on a daily basis. Greater diversity, equity, and inclusion in our research is a scientific and social imperative. And we can, again, expand on this in the letter that we submitted to the Academy. On behalf of the on ASHG, I want to applaud and encourage this very important work that this committee is doing. And ASHG is pleased that several members of this committee actually consider ASHG their professional home. So I'm really glad to see everybody on the screen. We have some recommendations, and just to go through them quickly. The concept of race and its ethnicity are social constructs. I'm sure you've heard this repeatedly. Use of a race category should be eliminated as a population descriptor, replaced by biologically meaningful descriptors. And on occasion, it may be necessary to include racial categories in research, especially when we are studying something like the effect of racism on how we deploy genomic medicine. Similarly, ethnicity is poorly defined. Utility is limited from a genetic standpoint. Racial and ethnic categories are currently used as imperfect proxies for human genetic variation due to lack of clear alternatives. And I hope that at the end of this committee, that we will have some leads in that direction. This is why the work of the committee, again, is critically important. In contrast, genetic ancestry, again, I highlighted genetic in this case because although ancestry is used colloquially, But there's really nothing like genetic ancestry. Ancestry is genetic. So to say genetic ancestry, I think is what I call that tautology. There's no other way to define ancestry but to use genetics. People can misuse it, but that is not the definition of ancestry. However, definitions commonly used are broad and inconsistent, like what I just said. The society, I think, provides further details on this point in our written report to the Academy, to this committee. And I just wanted to end by, my slide is not advancing. I think I have one more comment.
Okay.
I'm not sure. Okay, here we go. Yes. Concluding remarks. ASHG hopes that this committee will clarify topics and terminology when genetics is not relevant. ASHG is enthusiastic to play a collaborative role to build broad awareness about the recommendations coming out of this committee. And we applaud the work of this committee and appreciate the opportunity to share our society thinking as the committee begins its deliberation. So thank you very much, and I'll stop sharing.
Thank you, Dr. Rotini. And our next speaker is Dr. Judith Kumotini. Dr. Kumotini is the Bioinformatics Manager and Human Capacity Development Manager for H3 Africa Bioinformatics Network, as well as the Center for Proteomic and Genomic Research.
Hi, can you hear me? And can you see my slides?
Yes, we can.
Thank you. I can't move my slides for some reason. So I'm trying to move my slides.
Okay, we were able to see it earlier.
I'm going to try once more now. Let me see. Can you see this? Okay. Yes. So thank you very much for the invitation to share my perspective and view. And this is such an important and timely topic to discuss. And I want to straight away go into this slide where I want to highlight some of the experience I've learned over the decade living and working in Africa. I'm not an expert in African history, that's a disclaimer. One of the aspects that I've learned and know to achieve precision medicine and implementation of precision health and PRS that will be effective is to not only have the genetic component, but also to have the detailed information, that the granularity that is required from phenotype and population descriptors. So one of the aspects of these African masks are not only they're worn during ceremonial time, but also often they are hung outside the properties or at the entrance of the villages that have highly condensed information of ancestry, gender, geographical location, social status, language the tribe or the individual spoke, and much more. And is quite enriched, and you could study these aspects of detailed individual ancestry of where these groups have come from and traveled to, and so on and so forth. So the previous discussions when I attended this talk, and I was deeply touched by some of the topics because it's very close to my heart. What I want to point out and bring to the attention is that it is not, we shouldn't be looking at genomics impact on genetic diversity and genetic ancestry alone or independently. This has to be looked at together with the environmental contribution, so i.e. the geographical location and the language and religion, the combination of all these build a profile of an individual. You are some of your experiences, so it is where you have been and where you have, how far you have come, and all of that is a combination of data that phenotypic and metadata that we need to collect. And it is, of course, a challenging component from self-identification of ethnicity, ancestry, etc., with the social issues that are added on. So there are various ways to look at this problem and try and solve the problem. So one aspect of what we can do right now to overcome this issue, to reduce the false positiveness of collecting self-identified data, and also how do we gain the trust in public and increase the granularity of the data that we need in order to achieve the precision and to progress science, advanced science, and for the greater goodness. So there are four overarching greater components that are highlighted here. One is the increasing the literacy rate of public and participants in genomics, precision health, and the benefit and consequences of utilizing ancestry information, geographical information, or combination of such. And presentation of such evidence, what exists and why we are collecting, as opposed to we are collecting, for example. And not only to look at this as a challenge that we have to overcome, but also look at it as an opportunity for us to overcome these challenges. And there are lots of technologies that is available to us beyond artificial intelligence, blockchain, etc., that we won't be able to trace data, we won't be able to we can maintain the anonymity of patients and participant information, etc., and how best we exploit these technologies that are, thank you, available to us. And the last, not least, the policy implementation and the legislative change that is needed of a misuse of such data, and to gain all of these together, put together, would gain increase in the public trust in science and genomics. Thank you. And I also want to make one last point, and all these views are of my own, and it doesn't represent H3A or H3A Barnett, who I'm funded by, and nor of my institute. Thank you.
Thank you so much, Dr. Kumitini. Our next speaker is Dr. Shishi Liu. Dr. Liu is the Associate Director in Bioinformatics and Infectious Disease at Helix Genomics.
Thank you, Katrina, and thank you for this opportunity. I would just like to say my comment today is my own opinion, and it's from the perspective of a research scientist. My PhD is in mathematics, where I also studied the evolution of infectious diseases. In my postdoctoral period, I moved into human genetics, and my research has been in the field of human genetics ever since. So my angle is a little bit different from the comments so far. And I feel like self-reported race, ethnicity, and ancestry are useful for characterizing the composition of a cohort in genetics research. And they're important for measuring the diversity of a cohort and ensuring that the research we perform benefits everyone. However, all too often, genetically derived labels, which are imposed rather than self-reported, are used as a proxy. So this is sort of the reverse issue to what many of the speakers today have been addressing. And so I find this problematic in three distinct ways. First, there is a fraught history of scientists assigning racial labels to individuals. And second, this approach sweeps under the rug the complexities and imperfections that are in the algorithms for generating these labels that are not widely spoken about publicly. And third, because genetic ancestry labels are correlated with racial groupings, lay audiences may not always appreciate the distinction between the scientific use of a genetic ancestry label for the purposes of advancing genetics research and what that word may conjure up in their mind. And an obvious example of this is the use of the word European, which may be used by scientists as merely an adjective to describe humans that have been largely geographically isolated on the continent of Europe. But to a layperson who doesn't understand, that's why we use that adjective. It just sounds like the social construct of being white. And so for those three reasons, I feel like genetically derived labels, which are calculated and imposed rather than self-reported, are problematic. Today, I don't have any solutions. I'm very grateful for this committee and for this meeting, because I'm looking forward to what the recommendations are. But two ways I see of improving the status quo, and this is coming from my perspective as a researcher, is one, let's mandate ethics training for everyone who does genetics research on humans. I came to human genetics as a postdoc, so I didn't get that training as part of my PhD. And a lot of what I've learned is through reading on my own and through later receiving training on human genetics research. And the second way I can think of is to just, if we are using, if we're trying to come up with population descriptors to characterize diversity of a cohort, please use self-reported descriptors and make a distinction for when genetically derived descriptors are used and justify why those genetically derived descriptors are necessary. Thank you.
Thank you so much, Dr. Liu. Our next speaker is Ms. Ulia Ortega, Vice President of iHope Genetic Health and Genetic Alliance. Thanks.
Thank you so much, Dr. Claw. And thank you to the committee for requesting comments on the use of race and ethnicity and ancestry as population descriptors. And I'm thankful, like other people, that efforts are being made to better understand this use. I'd like to contribute by offering my comment, first as a woman of color, and then second with some anecdotes that helps underscore the confusion that's in the field. Now, when I say woman of color, that can mean a lot of things to different people, depending on your perspective. And to add to the complexity, I may also refer to myself in different ways, depending on who I'm speaking with. So my mother is from Baltimore, Maryland. Her ancestry includes West African, Native American, and German. She also recounts names that she's been called as a child and how others perceived her, and this includes being seen as Negro, darky, colored, and African American, so these have changed over time. My father is from Marianao, Cuba, and his ancestors migrated from Spain. He immigrated to New York when he was 14, but he was also seen as Negro and colored and African American and different terms over time. I looked recently at a doctor's note of my father's that I read, and throughout he was described as a white male. So I became interested certainly in learning more about how my parents had been called over time and also how I was being categorized and what the descriptors of other people when they thought of me were. So some close friends refer to me as a Black woman, while my Cuban cousin refers to me as her little Latina prima. My ancestry report shows that I'm about 60% West African, about 27% European. And I decided to also look at my medical notes after seeing my dad's, and my primary care clinician refers to me as an African American woman, yet I've never had a discussion with her or been asked about my ethnicity. So when I think about the absence of this discussion, I also begin to feel unseen and question what has been missed in the exchanges that I have with my provider because of the lack of having this conversation. And additionally, as a clinician myself, I'm wondering how many times did I unconsciously overlook the core of who someone is and what they identify with and their cultural values because I didn't ask them about their ethnicity. So if I had been asked about my ethnicity and had this question posed to me as a teenager, I would have said that I'm African American. As an adult, I respond and say that I'm an African American Cuban woman because I'm more aware of the importance of declaring how I see myself and how I name myself and how I like to be described. And when I think of genomic research studies that I've worked on as a clinical researcher, roughly 10% have asked for ethnicity. And of those 10%, the questions are directed to clinicians who are completing the case report form or the survey. So we know from each of our experiences and from my example above that this is woefully inaccurate, particularly if the clinician never asks the participant about their ethnicity. This has dire consequences for genomic research and for tests that are dependent on accurate interpretation based on knowing the population from which samples are collected. And correlations in research outcomes are certainly difficult to align to specific populations when the question is not asked, and if it is asked, it's not accurate in its collection. So genomic research studies, in my opinion, need to collect the population descriptor from the participant, from the individual, and from the clinician. However, as you can see, there are a lot of different ways in which the individual and the clinician can use these descriptors. So I hope my own disclosures and self-report help the committee in this discussion. Thank you for your time.
Thank you, Ms. Ortega. And our last and final speaker is Dr. Keolu Fox. He is at the Department of Anthropology at the University of California, San Diego.
Aloha, Katrina. Is it okay if I start my video? Oh, there we go. Okay, perfect. Awesome. Thank you, everybody, for the opportunity. I'll just share a few slides here. I hope you can hear me well.
Yes, we can hear you.
Okay, perfect. All right. Okay. Perfect. Okay, thank you everyone for the opportunity. This is such a valuable conversation. I've actually chosen something kind of special to present that's oddly topical. And it was a response piece that myself, Latifah Jackson from Howard University, and Crystal Tosi, my fellow co-founder of the Native Biodata Consortia, the first independent genome center on a reservation in US history. It was a response we wrote in Nature to an article about naming and the kind of lumping and splitting that we create around race, whether it involves genomic information as variables or not. And we entitled it Changing the Wrapping Paper. Wrapping won't fix the genetic racism problem. And here you can see this picture of someone wrapping a gift, and who wraps the gift matters, and how many colors of wrapping paper are there matter. And that will make sense in a moment. First, I think we've all seen this incredible tool by Melinda Mills, the GWAS Diversity Monitor, where we can look at live updates almost weekly or monthly. In this case, this was most recently updated on January 18th. And we can see the disproportionate number of individuals that are included in GWAS studies. This is approaching 96%, which is oddly the exact number that Carlos Bustamante and Esteban Bouchard presented in their 2010 piece, if you'll recall, Genomics for the World. But the other statistics that is even more disturbing to me is that 70% of these studies have been conducted by 3 countries, which means that places like, and not to discuss the continent of Africa as a monolith because it's not, but it is the most genetically diverse place on planet Earth. And you can see there's very little agency here based on forcing communities of people to outsource their genetic information. That's something that H3 Africa and Dr. Charles Rotimi have been hammering on and making a difference in that space for as long as I've been in genomics. But what this also means is that there's a lot of bias being introduced in the studies that are created, whether it's whole genome, exome, or any of your favorite sequencing methods. This means that our heritage, our culture, and our reflection of biodiversity is being outsourced to 3 countries, and they are the United States of America, the UK, and Iceland. And that represents a power imbalance where building capacity and training the next generation of scientists is going to be super critical. But there are other power imbalances in the way that we provide agency in terms of names. When you name something, you either give it agency or you take it away. And I want to talk about that. And there was a highly problematic piece that came out in Nature, and it says, too many scientists still say Caucasian. And we took an opportunity to address that. And we said, nature misses a chance to grant agency to marginalized communities, and inviting Alice Popejoy to point out that altering racial classifications will not absolve power imbalances in genetics. In a sense, it doesn't really matter what you call it. It matters who's doing the naming and who is in charge of providing agency, who's in control of the data, and who's in governance of that data. And how does that work? And all of us know that there's this history of lumping and splitting, kind of starting with these continental models of providing and classifying genetic information on a continental scale, saying Asian, which Asian do you mean? Saying African, which African do you mean? Even saying Polynesian is becoming highly problematic in 2022, because as you know, that includes Hawaiians, Tahitians, Samoans, etc. So speak with precision is one thing that I'm noticing throughout this conversation. And then demolishing genetic racism is another thing we say. So deferring to communities to self-identifying their belongingness. I notice that's a thing that a lot of people are saying, and that's a great step forward. Really looking forward to that. This is an image that was taken from Miley Arvin's book about possession Polynesia. And again, providing agency for our people and creating sovereignty around our data and information.
We have about a minute, Caleb.
Oh, okay, cool. Finally, I just wanted to talk about building our own institutions. These are many of the institutions that we've started or are a part of. The Lab to Land Institute is Radical Science for Climate Resilience, where we're focusing on synthetic biology and climate resilience. This is the Indigenous Futures Institute I'm a co-founder and co-director of, and the Native Biodata Consortia, which many of you are probably familiar with, and then Enrich. And then finally, in terms of providing agency, this is my last slide, it's always nice to get to work on the genomes of your own people. And when I started my job, one of my faculty mentors said, as I started as an assistant professor, said, it's not objective for Hawaiian people to work on Hawaiian people's genomes, right? So it feels really good to get to publish this paper in Nature, where we get to use our language, Hawaiian and many other languages, to describe the indigenous communities. And it feels even better to get to write a commentary piece for the people about these issues in Scientific American. Thank you so much for the opportunity, Katrina and everyone. Aloha.
Thank you so much, Kealu. And I just want to say thank you so much to all of the speakers for providing their comments to the committee. We do have about 12 minutes for questions, so I would like to call on the committee members to turn on their cameras as well as our speakers, and we can take questions from the committee at this time. Okay, any burning questions from the committee? Aravinda?
Yeah, it's easy to begin and say thank you so much. I really enjoyed the different perspectives that you gave, not all of which are completely, along one path. They represent different views, and I think we really do have a challenge, which is why it's the work we have to do to find. I don't mean to use the middle ground as something not controversial, but to do the right thing through all of these views. But I wanted to ask each of you that if there was one thing that you thought that we should leave today's meeting with. Some of you were very clear. Others, I don't know whether I wasn't paying attention or didn't understand. I'm just wondering if you would leave us with that thought very simply. What is the one thought you think the committee should get from your conversation? And I don't know whether Catherine Potensky is around, but and Charles, you could go. Julia, you could go. Why don't I ask Julia? Go ahead.
Well, there are a lot of different things. One main thing that really stayed with me, which I think is important to leave with, is that people should have the right to name themselves and define for themselves how they're called and how they want people to call them.
Thank you. Thank you.
This is Donna Cryer. May I respond? That resounds so much with me in some areas of research, in social research. But in genomic research on drug response, however, it doesn't resonate with me as much because the validity of that and the applicability of that is not quite as close. What I heard, though, throughout listening to all of the remarks was the word precision. But I think how we arrive at precision is different depending on the context. And so I think for Native Hawaiians who know who they are, to be able to communicate and represent who they are accurately is different than me and I'll describe it this way, as an African-American woman, in Washington, D.C., who, as I can say, if believe my mother's story, that would be a different composition. But if I look at my actual genetic results, that's different. So if we were to get to precision for most purposes, I would really want to rely less on my self-identification and all the various shapes and intersectionality that could take in a social construct, and really look at the genome itself. But for those who can describe themselves accurately, I think it's helpful to do so. I really do think that the way that we'll get there is by doing a better job on the governance and the power structure pieces as we move this conversation forward. So I really appreciate that those were part of this commentary as well.
Yeah, I just wanted to follow up on that, which I think is really an important point. While I am absolutely 100% supportive of people describing themselves, but I'm sure all of us here have seen some of the ad on TV from 23andMe after people have done their ancestry. And just about everybody I've seen says, oh, I didn't know I have that.
Mm-hmm.
So if we are relying on self-descriptions, how do we capture that? Because that particular part of that person's ancestry may be what is important for that condition that physician is looking at that point in time. So I think while we are celebrating people identifying themselves, we have to also be very aware that self-awareness may not be complete. Mm-hmm. And also history makes some people, history of racism, deny a certain part of their ancestry. So if they say, if you see somebody say, I have African ancestry, but when they go about living their daily lives, some people can just disregard that, go on. So I think we need to be conscious of these things as we highlight the importance of self-descriptors. The other point I want to make is we need to be very clear about this. Ancestry is genetic. There is no other way to define your ancestry unless you're just using it in a colloquial term. So that's just, it is like trying to define, your cholesterol level. You have to measure it and you have certain data that comes out of it. It doesn't matter whether you're African or this, of course, if you're interested in the environmental context, that's important. So I just want us to be, Arvinda, you asked for some high level kind of thing. I think Ancestry is a very good one if we have enough genomic data around the world to help us properly define the right collections of ancestry around the world. And to emphasize the point that we are all admixed. Mm-hmm. We did a study on average, every human being that we studied, over 6,000 individuals, had an average 4 ancestries. So, and a lot of the individuals in that study did not know that they have those ancestral combinations. So what does self-identity therefore means? in genetic studies. Yeah.
Can I jump on that, Dr. Otime? I think that's a very important frame for this discussion. But I also want to, as an anthropologist and as someone who works in genetics, push back a little bit, because genetic ancestry is exactly what you talk about. But kinship and ancestry and belonging are incredibly real and incredibly powerful, just not necessarily connected or necessarily even correlated with genetic ancestry. So I like, for example, Mathiasen and Scalwade's sort of multiple kinds of ancestry, right? Genetic ancestry, genealogy, genetic similarity, but then also the very important notion of history and language and perception for different cultural groups. So I think there's if you refine it just to genetic ancestry, I agree. But my take home, though, is related to that. And that is, we know how to calculate genetic ancestry and what it does and does not tell us in many ways. We also know that race and continental groupings are not biologically accurate reflections. And so we can move beyond that while still being attentive to self-identified connections, to ethnicities, to the complexity of patterns when we're doing biomedical research. I think we just need to be very clear about it, because the continued use, as it was introduced multiple times here, the continued use of race and ancestry categories recapitulates intentional racism structuring the way in which science and people see the world. And that's not, it is, both of those are totally contradicted by the actual genomic diversity in humans.
I'm just wondering, I'm sorry to ask another question just to clarify for the committee. I presume all of you would be in favor of explaining what we are going to do about their descriptions in a consent form. When we seek consent from an individual to participate in a study, what do you believe we should seek consent for? I understand the scientific questions, but should we just ask them the questions, or should we say, we are also going to calculate your genetic ancestry?
Before people have a chance to answer that second question, I know that Dr. Fox has had his hand up.
Oh, I'm sorry.
Oh, no problem, Professor Chakrabarty. I just wanted to kind of add in a few takes. I think one of the big elephants in the room is the idea that we really need to acknowledge that data is a resource. And I think it's not just a resource, it's the number one resource on planet Earth. And so providing communities with agency and really thinking about data governance, because there's almost every single person that had time to speak mentioned this issue. And I think that's the most timely one. And it really gets down to everything. So if somebody to answer your second question, if somebody knows what their genome is worth in terms of its value, then would they actually consent to anything? So I think that's a more philosophical question for a future National Academies sort of meeting. But thank you for the opportunity.
Thank you.
But Keolu, I just wanted to follow up on that. Again, it's an important point. But I think part of the issue is, I think we tend to define benefit too narrowly when it comes to some of this research work. For example, when we started History Africa, there was this really strong pushback about, how is this data going to benefit Africans? And that past research did not benefit Africans. So I asked the audience, I said, how many of you here take hypertensive drug? How many of you here take diabetic drug? And there was quite a few hands that were up. I said, do you know none of those research was done in African people, but they are benefiting you? So I think we need to expand the context within which we are doing things. And I fully support that communities need to be represented in this work. But we cannot conflate that with descriptors. We need to facilitate global engagement in genomics everywhere around the world. But that is the different issue that we are discussing here today. It's very different. We are saying, how do we scientifically make recommendations to how we do genetic research? And I think if we conflate all of these things, we will just be very, very distracted, and we will come right back to where we are today. That's my concern.
Well, thank you so much, everyone, for everyone's questions today. We've had the opportunity to hear many speakers, their personal views on identity, and also from journals, universities, societies, health consortiums, and institutes. And I want to also say that we will have the public portal up, and I'd like to encourage any of you listening to our webinar today to provide your thoughts to the committee. You can find the link to the comment portal on our study website, and I'll hand it back to the chairs to wrap up.
All right. Thank you, Katrina, sorry. And this stimulating conversations that we've had today. I have the daunting task. I'm Charmaine Royal and have the daunting task of wrapping up in 5 minutes. And I'm gonna just touch on a couple of things as I listened today, and in the last session, Lance kind of took the approach that I have been thinking about all day that I was going to take in wrapping up, and it's starting from Pilar and bring us all the way to the end, and the similarities and the differences in the perspectives. And Pilar started us off, talking about where we've come in terms of this conversation. And many of us, most if not all of us, certainly on the committee and many who participated today, have been part of a lot of these conversations. And Pilar's question was, why are we still here and we haven't made more progress? And her points were, we're probably not asking the right questions, or we may not be asking them in the right way. And then there may be barriers to progress. And the questions she focused on was this question of, do we use race, ethnicity, ancestry as descriptors or not? And that is a question people have been trying to answer. And her perspective was that may not be the question. The question may be when, how, why we use these variables. And as we heard today, there are lots of perspectives on that. There's some, I know Rena talked about us needing to stop using those variables and use them only when we're thinking about the impacts of racism, and there are other perspectives on that. But the question still stands, and we came to Malia at the end of session 2, and Malia kind of reiterated that perspective as she went back to the Genome Institute saying moving beyond, and her perspective was that might be a pipe dream, and we may, and the question is, should we move beyond? So that remains a question, and 2 questions there. Pilar also talked about definition. She started talking about populations, but throughout the day, the word population, what it means, how we define it. Throughout the day, we've added a whole lot of words that we need to define, including descent, ancestry, right? Genetic ancestry versus ancestry. What are we talking about? And many have said, well, instead of using race, we should use ancestry or genetic ancestry. But as Tess and others said, ancestry itself is complicated and imprecise, or can be complicated and imprecise. And then Tess talked about, well, Tess and many others started with Pilar talking about how we move toward progress. And one of the recurring themes today is that we have to think about context. As we look at genomics and we do genomics research, and we look at health and disease don't just appear because of your genes. There are all these other things that are involved in the disease process and health, because we also need to think about both health and disease. So thinking about context or environments or experiences and how we bring those into the conversation and also into the research. And that is that's a consistent theme. But of course, the question is, how do we do that? How do we move beyond the linear models or the simple models that we've had to really more closely approximate the actual complexity of health and disease? And that remains a major challenge. And he talked about the benefits and limitations of looking at genomics and using genomic approaches, even if we're not using labels and we're focusing on genetic variation. There are limitations there. He talked about not only just being able to use statistical tricks, there's so much else that goes into how we think about our work. And I'm going to wrap up with just talking a little bit about the ecosystem. All of the talks today touched on this ecosystem, what I call the human genomics research ecosystem, that includes journal editors, and we heard from some, and the populations themselves and individuals, right? We had the conversation about translation needing to move us from populations to individuals and how we look at individuals in the clinical system. So that whole ecosystem becomes part of the conversation. And then I'll end by, she said, she made her comments and she said, I don't have a lot of solutions. I'm counting on the committee. And so my fellow committee members, Aravinda, we've got our work cut out for us. There are all these issues that are such important issues, but they're contradictions and confusion, if I may say so. And so thinking about how we move forward, addressing all these things, the context, and Kilo talked about agency and governance and whose voices are heard. So as we move forward, I just want us to, the committee for sure will take all that we've heard today and make sense of it as we prepare our report and attempt to address it to the best of our ability. So thanks to the speakers, thanks to the moderators, fellow committee members, the audience who joined us in this webinar, and of course the amazing NASM staff. The comments and the feedback and the conversations are invaluable to us, the committee, as we move forward to our work. We have our next public session coming up on June 14th. So save the date for those listening in and want to continue listening in on our work. Sign up for the email list on the study website so you can be notified when the registration opens up for the June 14th open public session. And then finally, to remind folks that our open comment opportunity will remain open through June 1st. And so we do want to hear from folks. So anyone who has additional comments on this conversation and conversations that we'll be having in the future as we think about how we move forward and how we move the conversation, but also the work to address the charge, this awesome and challenging charge that we've been given. And on that note, I'll just say a final thank you to everyone. Aravinda, any thoughts?
You summed it up beautifully. I don't think we can say it enough times. Thank you for the speakers. Despite our task, they were clarifying each of them individually. We really thank you for your work. Thanks to the committee. And hopefully we will see each other very soon.
Yes, thank you. Bye, everyone. Have a good evening.